Hey everybody, sorry that we're running a few minutes behind. We had some technical difficulties with Jen. I always think that we're super prepared and then we're not. I guess it's our learning curve. But I'm going to add her on in just a few seconds. I've got it fixed and it looks like she's on now, which is awesome. Just going to add you in, Jen. Give me 1 second. Yay! We have lots of awesome questions that were submitted for Jen. I'm really excited to have her on. Jen, if you just accept the addition. Hi.
Hi, how are you? Can you hear me?
Good. Yes, I hear you. Great.
Excellent.
Sorry that
I'm turning my computer off so I don't get some feedback.
Okay, sounds good.
Yeah. There we go.
Perfect. Sorry that was so confusing, but here we are. And that's all that matters, right?
Yes.
Oh. Okay. So Jen, why don't you tell us a little bit about who you are first? A little introduction.
So you get to pick which part of me. Professionally, I am a chiropractor who's been practicing in Eastern Connecticut and more recently west of the river for the last almost 20 years. I just entered my 20th year of practice in August. I am a happy mom of 2 crazy boys because that keeps you busy. Predominantly, my practice is based in pediatrics and maternal health, but we are happy to accept families of all makes and models.
Awesome. So I know you really well. So this is, sort of bizarre to ask you questions. I know a lot of the answers to, but we've received really good questions, probably some of the best questions we received for any of the Facebook Live. So why don't we just get started? And then if anybody who's watching has questions, feel free to ask them, type them down below, and we'll pay attention and try to watch those.
Whoops.
Oh, you're...
That was my finger. I'm trying to take my phone out of the case, folks, because it'll overheat. There we go.
That's okay. Perfect. All right. So the first question that we received was from Stephanie in Windsor, and she wants to know if she can receive chiropractic care at any stage of her pregnancy.
Hi, Stephanie. I hope you're watching. Of course you can. Now, one of the things to think about is finding somebody who is comfortable and skilled with pregnant mamas. Not all of us are going to be, and hopefully if you find a chiropractor who isn't, they're going to say so, and they'll send you to one of us who is. I've worked on moms who are trying to get pregnant. I've worked on women all the way through to having a woman in labor on my table, both in beginning stages of labor and a little farther along. There are some contraindications here and there. And again, that's where coming to somebody who's comfortable and has the knowledge is a great idea. But you can definitely receive chiropractic care throughout your pregnancy.
Is there continuing education for somebody in chiropractic care to do, maternity centered care? Or is it just,
there is.
Okay.
Well, there's both. There really is both. There's a level of simple comfort. Working on a pregnant belly does require some different techniques. I mean, I'm not going to try and lay somebody who's 8 months pregnant on their stomach without some extra support. So for some people, the joy of my phone, things are going to pop up and I might
no, that's
funny
okay.
Look every so often.
That's okay.
The joy of that comfort level is I've gotten those years under my belt and the techniques and the tools, as well as just simply learning to listen. And having been pregnant myself twice, I remember what that felt like. There is continuing education, both at simply a state level. Go catch a seminar here and again. And if you have a chiropractor you love, ask them. It's not a big deal to go to an Adjusting the Pregnant Mother seminar. We do see them in Connecticut. We see them in other states too. Go for a trip. It's not a bad way to see some of the country sometimes. There's also extended continuing education. I spent the last 3 years of my life driving back and forth to Montreal once a month. After 3 years of that, 3 exams later, an oral exam later, I received extra credentials that certify me as a diplomate in clinical chiropractic pediatrics. Part of that also is working in the maternal population.
That makes sense. Evelyn just asked a question that somebody else has previously asked too, so we might as well just go right to that one, which is what benefits and precautions are there to consider for an older children, say 6 or so?
Well, benefits,
Yeah.
It's going to vary on your child, but if you think about how our 6-year-olds bounce around, play, fall off things, fall out of trees, roll down the slide, land on their bottom, and then add into that what they've all just started to do, which is they're now back in school. They're sitting at a desk for 6 to 8 hours a day, some of them on a computer for all of that, carrying a backpack. That's not a lot different than us, is it, Evelyn? So a lot of the benefits we're going to see are similar benefits to what we'd see in a grown-up. You're going to see better mobility. You're going to see more movement. You're going to see a lessening of those kinds of chronic overuse injuries that pain me to see in a kid. Add into that, a lot of these kids are playing sport, and a lot of them are playing sport year-round. And that, again, has some overuse aspects. If you've got a kid who's fabulous at soccer, they're probably playing 10 months out of the year. Now we're looking at sports-related injuries. Maybe your kid doesn't have any of that. Maybe your kid has a hard time concentrating. You can work on a child's head and see some really nice benefits as far as that kid who just can't pull it together. Maybe they've got tight muscles. Maybe their vision is in question. Having someone who's seeing them on a routine basis can really help identify some of those difficulties. Contraindications, risks, because there's always risks. Right. Again, when we're working with a childhood population, the force with which I'm going to adjust a kiddo is dramatically different than I'm going to adjust a grown-up. And something I've said to a lot of my grown-ups is I've learned so many lessons from my kids, so many. And one of them is you've got to have different tools for each job. When I'm working on a child, I'm using a very light force. I'm talking to them a lot about what's coming, what it's going to feel like, what it's going to sound like. Sound is a scary thing when you don't know what it's going to be.
Oh, yeah, absolutely. Yeah.
So you've got some light risks. You could see a sprain if somebody was really, really, really tight. Again, I'd like to tell you that's never going to happen, but for some people it might. You might have some muscle soreness because that can happen, especially in a situation where I've got a little kid who's all in a ball. That doesn't look right on the phone, but you get what I'm trying to say.
Yeah.
You're going to have some
what's so interesting was that my 5-year-old, he's now 6, but at the time was 5. He saw Dr. Liz Gianfrido, who's not here, but he was having speech delays. And it ended up being that everything in here was just so tight.
Yeah.
And he was grinding his teeth at night and all kinds of other things. And surprisingly enough, lots of speech therapy, was making little progress. But when he started seeing a chiropractor for that, I think it was 3 or 4 weeks, his speech was dramatically changing. So much so that his teacher was like, what are you doing?
Exactly.
What's happening?
And
it was something I had never thought about.
Oh, well, totally. And that's all anecdotal in that we don't have a lot of the evidence-based research. We'd love to have that because you don't have a lot of people doing it. And it's not something that your speech therapist is going to go, hey, go see the chiropractor. I've seen the same thing. I've seen the marbles in the mouth disappear and that enunciation actually occur. Childhood illnesses, if you start thinking about, again, they're back in school. We all know what's coming next. How many colds do you think we're all going to see? Right. Keeping that immune system working well, keeping the lymph flowing so it's not pooling in their sinuses or their ears. You don't want another ear infection. 6-year-olds with ear infections are no fun.
No, they
30-year-olds with ear infections, less fun. But those are all benefits you're going to see. The risks really are, I'll tell you, some kids get afraid because they're not used to people touching them. And if you're heavy-handed, it's gonna hurt. Again, I do my best not to do that to them.
I've seen you interact though with so many kids. Like, you're fun. You sink down to their level. You talk to them like at eye level. You feel safe. And I think that that's really important. I have shy kids. And, today on the way to school, they asked me, what are you doing today, Mommy? I said, I'm going on live Facebook with Dr. Jen. They were like, oh, Dr. Jen, So
Dr. Jen, who has the toys.
Yes, exactly. So
and that's another piece. I realize it's not part of the question necessarily, but if you're looking for somebody for your kids, find someone who's got a family-friendly office. Find an office where your kids feel comfortable because, we've all been to that doctor's office that is sanitized and has the smell, and you sit there and you don't feel welcome.
Right.
Don't ever do that to your kids. Find some place where if your kids run around, no one's going to look at them funny. Find a place where it's okay for them to be children. That's going to help them. And as Melissa said, Everyone laughs at me because I usually come to work in yoga pants. And there's a reason,
Right.
because I'm going to be on the floor with a 4-year-old chasing them around. And I don't need a skirt dragging behind me, and I don't need heels, and I certainly don't need to, quote, look the part.
Somebody said Finn says hi. I'm sure that's one of the
Oh, yeah.
a kid, Megan Lee says.
Yeah, I was going to say, tell Finn I love him too.
So another question that I liked was, what the heck is the Webster technique? Which I thought was so funny, because when I first started being a mom in lots of mom groups, people would, when women were complaining about pregnancy pain or that their babies were breech, everyone would respond about the Webster technique. And being pregnant with my first, I had absolutely no idea what that was or what it meant. And so I think it's a great question. What the heck is the Webster technique?
So I'll start with the basics on the Webster technique, because anything you can start with the basic and work your way up. Webster is meant as a technique to help spin a breech baby. That's its basis. That's what it comes from. The whole point to it is identifying which side of your tailbone, your sacrum, is tight, restricted, and allowing that to open up. Now, some people will practice simply that way. Lay you on your belly, check your hips, adjust your hip, send you on your way. So now we'll get into the more complex part of it. Your sacrum, especially pregnant, is likely to not be perfect because you're carrying a baby. And because we all sit in a car, we drive, we wear high heels, we do silly things that aren't the best for us, we tend to have a lot of tension in our lower pelvis, around our uterus, not pregnant. Now add the weight of a fetus to that. And it's often that the uterus isn't going to sit perfectly up and down with equal tension on both round ligaments. And here's where I want my hands. This is the problem. I need to be talking with my hands. The round ligaments, for those of you who don't know, are the ligament that runs from your pubic bone to the top of your uterus. So not pregnant, they're about that big. 36 weeks pregnant, they're considerably larger, about 36 centimeters. That's running from your pubic bone above your belly button. So for the women who experience that really low groin pain through pregnancy, or the one that just hits you like a hot shot and makes you want to curl up in a ball, that's often your round ligament. If those are gently released, and using a technique like myofascial release or energy release, it's really light work. Think about holding a dime in your fingers, that much pressure. The sacrum then also is able to release more readily. So your uterus can get more squared away, the soft tissue in your belly is softer, and the baby has a better chance of going head down.
So basically you're creating space for the baby.
You're creating a better space.
Okay.
Yeah.
Great. Do chiropractors take insurance? Was one of the questions.
That varies chiropractor to a chiropractor, and you want to speak to each one and find out. Some take no insurance. Some will ask you to file your claims yourself. Others take insurance. Some take some insurances, some take no other insurance. It's going to vary. I personally take everything except Husky. And frankly, Husky has no benefits for us grown-ups. It only has benefit for kids.
Okay. Oh, this was a good one too. I'm just going to read exactly what she wrote. Her name was Stephanie. She said, people keep suggesting that my baby gets chiropractic care, but I can't imagine his little body cracking up a storm. Please put me at ease.
Well, as I said earlier, Stephanie, the force I use on an infant, yesterday I was working on, I'm trying to think if he was 2 weeks old. I want to say he was 15 days old. And I was holding this baby and working on this baby, and Grandma was in the room. And Grandma finally looks at me and cocks her head and says, are you ever going to do anything to this child? And I laughed at her and I said, what do you think I've been doing for 15 minutes? Yeah. And she said, I'm not sure. That's as gentle as it's going to look like. It looks like I'm talking to your child and holding their head in my hands, and maybe they're safe head, and probably talking really softly or singing or having a nice little conversation about the day. We had a lot of conversations about weather yesterday. But I don't, generally speaking, you're not going to hear a crack out of your little one.
Right.
Generally. Every once
maybe
in a while,
out of a bigger, I know that, for my kids who are like 4, right? Like, out.
Yeah, it did.
My my kids who were, when they were like 4 or 5 or 6, there might have been a little bit of cracking, but when babies are little, their bodies aren't making noise, right? You're just releasing more different types of things.
Correct. Right. Every once in a while, and I'll tell you, if you're looking specifically at like maybe a really, really rough birth, you might hear a little tick, maybe. I'm probably more likely to feel that if it actually lets go osseously. But yeah, I every once in a while, a little baby will let go with a sound. More often than not, you just see this little one go from a little pent up to,
right. That's what everybody talks about. They just like knock right out, right? Yeah. They just feel like super release. Do you think that chiropractic care helps babies sleep? Was a question that we
sleep is such a hard thing.
I know.
So I don't ever make any promises to anyone for anything. Mostly because you can't. Some children won't sleep.
Right.
But for a lot of kids, it can help. They're not going to sleep the night. Let's be honest. My kids don't sleep the night now, and they're 10 and 13. They're still up at
Well, I don't sleep the night. Do you sleep through the night? I don't. I get up.
I haven't slept through the night since I was pregnant. I still have to pee at least once every night. Let's be honest.
Exactly. Yeah.
But, is it that quality of sleep? Sometimes the answer is yes. That there is something going on around their head and neck usually, but not always, that's not letting them get restful sleep. So it's something to look at. Sometimes it's tongue-tied. They're not getting enough oxygen, and so they're waking themselves. Sometimes it's that you've got a type A kid, and you know what? This kid's going to hit 18 and still not sleep. Right. It's hard to tell, but every so often, yeah. And it's an easy thing to try.
So earlier you mentioned how you had sometimes women who are in labor on your table, and 2 or 3 folks send in questions asking how soon postpartum can they receive chiropractic care?
That depends on your labor and your delivery and what you want worked on. I will happily work on a woman very shortly after she has her child. I'll work on her within days.
Okay.
But I usually will not work on her pelvis outside of soft tissue work.
Okay.
For so many of us, we've either torn and we have stitches, it's a C-section delivery, stitches, or you are just beyond sore. That's not you want your lower body to let go, but at the same time, you're not capable of letting it yet.
Right.
Anything from ribs up is fair game right off. And for a lot of you, your neck, your head hurts, your shoulders hurt because now you're carrying a baby.
Right, exactly. Like everyone's looking down at their baby. Yeah.
Exactly. All through here, all across the shoulder, all the way down the hand. That's all total fair game right off. There's no good reason that I couldn't work on you right away. Okay. But I always ask all my new moms, work with me. I'll get to your lower body when I feel like it's an okay time to do it. May not be as quick as you want, but I don't want to induce more harm before we're ready.
That makes perfect sense. Another question that came through as we were talking via PM is about lip and tongue ties. I think you sort of, went over it a little bit and mentioned it. And I know that, it's pretty common. And for people who don't know Dr. Jen, there's some people watching, I think, that don't. You have lots of experience and knowledge about lactation. So when I have clients who are struggling with breastfeeding, I always send them to you, even if the drive is really far, because you sort of come with two types of things that can help, right? Is your chiropractic care and your lactation and all of the other things that go around. So do you mind talking just a little bit about that?
Well, and that's probably an hour unto its own, Melissa, and you know that.
I know. That's why I said just a little
bit. So posterior tongue or lip ties, we'll start with just basic anatomy. A lip tie is going to happen right here. And if I flip a lip up, what you'd see is a tissue that's attaching from the inside of the lip to the gum, usually right about here, just before the teeth. Sometimes it'll wrap all the way under up into the palate. And it can be really thin and flexible, or it can be really thick and stringy and almost white and heavy. What can happen there is that lip is going to pull down instead of fish up. Two problems with this. The first is the baby's going to get a blister right here on the lip. The second is mama is likely to have some issues on her nipple because she's going to get abraded by that lip rubbing instead of flaring up and catching the top of the areola. Tongue ties under there. And if you looked closely, yeah, I have one. It's not as bad as it once was, but it's still there. That can inhibit or prohibit the tongue from coming out or like this, up. I still can't touch the roof of my mouth with my tongue, and I had it revised. So for an infant, they aren't able to take the breast, pull the breast in, and raise it to the palate. So they can't pull the milk through as effectively. So why is it a big deal? A few different pieces. The first is breastfeeding can be a nasty, nasty nightmare. Latch can be painful, toe-curlingly painful. And I'd put money, some of you out there watching know exactly what I mean. You can see compression at the nipple where it looks like, where it looks like a lipstick. You can see blanching where the nipple turns beautifully, beautifully white. You can see blisters. You can see erosion on the nipple. Or you might see nothing at all. You might see a really tired baby. The story I hear from these moms sometimes who don't realize what they're looking at is, my baby sleeps a lot. My baby nurses for 40 to 45 minutes at a time and then wakes up as soon as I put them down. And these are women who come in and they're exhausted. Now, not all of these need to be revised. Some of them we can work on. You can work that soft tissue to a point that it's more malleable and workable. Some of them need revisions. Some of these babies need that tissue removed so that they have better function. And we're still seeing down the road what impact that could have on us as adults, as kids. Sometimes you see speech impediment where they can't use that tongue. The tongue just doesn't get up here so that that th or sound becomes kind of muffled. Some of these kids gag. They just can't eat solids well, or they eat solids really late and are kind of picky about what they put in their mouth. Some kids we see, and this is more something we've seen now with grown-ups, there's thought to be a tie between that tongue tie and apnea, snoring, because we all love it when our husbands snore. But the problem is, by a grown-up, if I clip that and don't do a lot of soft tissue work, the tongue's already too big. It's gotten really bulky because it's fought against this pull down for our whole life. So it's something to look at as a kids, especially the little ones. If we can do it without revision, awesome. And if we can't, then sometimes we send to some of the experts out there who did a fabulous job with the revisions. And we're lucky.
And that's something that you can do, right? If someone came to see you and had a child with a tongue tie, you would be able to decide, help them decipher whether or not it may need a revision.
Very happily. I'm very comfortable in looking in their mouth, identifying what ties are present, identifying what we might want to look at, and giving moms and dads a good game plan of how we can approach things. What do we want to do? Who our providers are that really excel at this, and really looking at how do they want to proceed? What's your goal? For some parents, it's an absolute no. I do not want to do this revision under any circumstances. Okay, well then let's work around it. And let's have a backup plan just in case something doesn't go perfectly right.
Yep, that makes sense.
And I'm happy to write that referral to whoever the providers are outside as well.
Awesome. So we're talking a ton about, maternal and pediatric chiropractic care, but you also serve dads and people who aren't in the perinatal period of their lives too, right?
Correct, I do.
Okay.
As I said initially, I work predominantly at this point on maternal and peds. However, we are happy to see a whole family. I have plenty of single men. I have a lot of grandparents. It's the whole gamut. It's from birth to the end.
And something that I know personally about you is that you live a really active lifestyle. And so you do CrossFit and you're running through muds of, gallons of mud and like pulling yourself out of wet, dungeness things and Spartan races and stuff like that. You have, because of that, you also have exceptional care of, of providing to people who are doing those types of
So
things?
before I started pediatrics, I actually got my sports med certs. And I openly will admit, I have let them lapse in as much as I have been really busy with pediatrics. However, the skill set's still there. I just don't get to as many conferences as I'd like and didn't feel it was okay to keep the letters. But yes, as Melissa states, I do the crazy things. I don't do as much CrossFit anymore. I'm kind of in your boat too, that that has gone a little by the wayside and I need to pull that back into my world. Yeah. But I just got back from the joy of one of your friends just getting home. I just got back from a Spartan Beast, so 13.4 miles, I think, in Quebec City last weekend. And yes, I am black and blue all over the right side of my body from varying things. I don't know I run it. I would say I hiked that. But next weekend, not Labor Day, but the coming, I have another one. So that should be a little more of a run. But yes, I thoroughly have fun working with athletes of all makes, again, all makes and models, whether you're a weekend warrior or whether you're playing at one of our universities, you've got a welcome home in my office.
I think too, it's really important to mention, a lot of people know who you are, and in all the mom groups, everyone's like, oh, you need to see Dr. Jen, blah, blah, blah. But you recently brought on Dr. Matt Cella, who's absolutely awesome. I have seen him. He's adjusted me. He's fantastic. He gets on the floor. He shows you exercises to do and all of those things too. So if people feel more comfortable seeing him in, or you're not available, he's just as skilled and lovely. I just want to throw that out there.
And yes, thank you. Thank you. Yes. I was blessed that Dr. Matt came into our world about a year and a half ago, and he has fit in wonderfully. He is so happy to get on the floor and play with the kids and work on them, but play with them too. And he comes to us via Bridgeport and previous to that, Quinnipiac. His background is athletic training. So again, he's got it hitting on all cylinders as well. Matt is coming so quickly into his own, and he is absolutely wonderful with all our patients. And I have not had a single of my patients complain to me about his care. In fact, several of them have said, you know what? He's here more than you are. I'll see him. And I said, cool, great. Because I kind of do disappear once in a while. Not for long, but once in a while, I like my vanishing.
So I tagged your Facebook page in this so people can find you through there, and your website and everything else was in any newsletters and things that you get from Birth Tribe. But what hours are you where? So where can people find you?
So this is one where I'll speak slowly because it's not easy. On Mondays, both Dr. Matt and I are in Storrs from about 9:30 till about 4:30. The abouts come into play because if somebody needs us, we're going to do our best to make it happen. We all have personal lives, so sometimes that's not always going to be on exactly the calendar everyone would like, but we do our best. On Tuesdays, I make my way out to New Britain, where I am from about 8:45 till about 4:30, 5 o'clock at night. Dr. Matt is in Storrs that day from noon till 7. Wednesday, I'm in Storrs from about noon till 8. Dr. Matt is in West Hartford at West Hartford Acupuncture from 9 till about 4 o'clock. Thursdays, we both take the day off because we need some time off.
Yeah, good.
Friday morning, we're back at it again. Yeah.
In Storrs.
Friday morning, we're back at it. Both in Storrs from 8 till about 2 in the afternoon. And then Saturday mornings as well.
Great.
In Storrs.
I can't believe you have all of that memorized. That was really impressive that you had.
If I didn't, I'd get lost going to work.
Yeah, that makes perfect sense. On Tuesdays, Jen is in the office that we're in at Compass Wellness Center. We all share a space there. So if you're wondering where she is then, that's where she is. I think that's it. I think we answered all of our questions.
Wow.
Do you have anything else? I know. Excuse me.
Thank you for having me. This was absolutely lovely. Thank you all for bearing with us through our technical difficulties. I still don't know why my camera doesn't like Facebook, but apparently it doesn't.
Excuse me. Well, here we are, and it was great. Nice to talk to you. I'll see you soon.
Thanks. Thanks so much, Melissa. Have a great day.
You too. Bye.